One of the first questions that young parents ask me is my baby going to be okay? They want to know if the baby's going to grow up okay, if it's going to be born all right, and that's the first question. The second question I get from mom is, tell me about labor and delivery. Is it going to hurt? How am I going to get the baby out of there? What can you do to help me with labor and delivery? Labor itself is the process of when the contractions start. Contractions will start, they'll be painful, and when it starts to do something, when the mouth of the womb starts to open up, that's considered labor. And that's where you come to us for help. Labor is something that's happened centuries with humans and animals. It's designed to do one thing. It's designed to give you a baby. Nature doesn't care if it hurts. Everyone has a different expectation of what they want to do with the birthing process, and we try and accommodate that. We want the family to do what they want. Some mothers want to have completely natural, medicine-free labor, and that's okay. I find that in my years of experience, there are very few individual moms that don't feel any pain or very little pain during labor. It's amazing, but they just don't. It doesn't bother them, and they do very, very well with the process. Then there are a few that it's excruciating. From the time they have the first contraction, it's something that they can't tolerate, and they need a lot of help, and we're there for them. But most women are in the middle. It is painful. I call it a rewarding experience. Not a fun experience, it's rewarding. There are newer narcotics now that are short-acting and much safer, and they will help mom with the pain of the contractions. They'll help you actually relax a little bit in between the contractions, and they take the edge off the heightened, the really intense part. But no narcotic will take away the pain completely. If we give high doses of narcotics, which we can do, if we give high doses enough to really stop the pain, it becomes dangerous because the narcotics do cross over in the placenta to the baby, and the babies are born sleepy. Where we find narcotics are very helpful is in early labor, to allow mom to relax a little bit and to enjoy the best that she can to participate in the process. So the advantage of the narcotic, it's easy to use, there's no procedures necessary. The disadvantage is if we use too high of a dose for too long of a period, it can make the baby sleepy. The use of epidural anesthetic is one of the more popular and more common methods of pain relief that we're using in modern hospitals. An epidural anesthetic is where an anesthesiologist takes a very small plastic tube and inserts it into your back, and it usually stays there during the course of labor. It gives a medicine in a slow measured dose to the outside of the spinal canal. So it bathes the nerve roots in an anesthetic that helps with pain control. It still allows mom to push. She has enough sensation where she can feel the baby coming out. Normally without an epidural, it hurts a lot. You're trying to push the baby out as fast as you can. So the average for a first baby might be 1.5 hours to 2 hours of pushing. With an epidural, it might be a half hour or so longer because your pushing is controlled. You're not in quite such a hurry to have the baby, so it sometimes takes a little bit longer. But it's personal choice. I happen to have 6 children, my wife and myself, 6 children. She did most of the work. And she had an epidural with all 6 of our children because her philosophy was I wanted to participate. She wanted to participate in the process. She wanted to see the baby being born. She didn't want to be uncomfortable with the process. She wanted to enjoy it as best she could. Now that's not for everybody because many of my patients would rather not use anesthetic and they feel that it's a closer to nature phenomena. It truly is personal choice. And then as I advise all my patients, have an open mind. Unless you've had a baby before, you're not going to know how you react to labor, to the discomfort, to the pain, to the surroundings. And you don't have to make up your mind until it actually begins. What you should know is what are some of the options available, and you'll work with the nurses and with your doctor to decide what you think is best for you. You need to be as prepared as possible, which we'll help you with, whether it's classes, whether it's education beforehand, so that you know exactly what options are here for you. And our goal, my goal, is to make it as pleasant experience and give you the best result possible.